Good morning everyone. Welcome back to my channel. Today also I will cover about the terminologies which is using for the obstetrical gynecology. Before starting that, if you are watching my channel, please share and subscribe if you are a nursing student. Preterm birth. What is this preterm birth? Already I told you the normal gestational period is 40 weeks. Okay. So the 40 weeks, the baby birth occurs after the or at the 40 weeks, right? So what is happening in the preterm birth? The preterm birth occurs in between the 24 to 37 weeks. The birth occurs in between the 24 and 37 weeks. That birth is known as preterm birth. Okay. And another is post-term birth. What is this post-term birth? The birth not occurred after 42 weeks. Normal it is 40 weeks. So the baby has not delivered even after 42 weeks. That is known as post-term birth. So the birth occurs after the 42 weeks. That is known as post-term birth. The preterm means in between 24 to 37 weeks the birth occurs, that is preterm birth, and the postterm birth occurs when after the 42 weeks, and the normal birth occurs at 40 weeks or 280 days. Another important terminology is presentation. What is that? Presentation. So what is this presentation? That means which of the anatomical part of the fetus which is very closest to the pelvic inlet just before the birth, or which anatomical part is leading to the pelvic inlet of the mother during the time of delivery. That is known as presentation. So according to the leading part, it identified as cephalic presentation, breech presentation, shoulder presentations. So what is this cephalic? Once the fetus head is leading to the pelvic inlet just before the birth, or the head is enters to the pelvic inlet during the time of delivery, that presentation is known as cephalic presentation. Another is breech presentation. What is this breech presentation? Breech presentation means once the buttocks or foot or feet is leading to the pelvic inlet at the time of delivery. So that is breech presentation. And another is shoulders or shoulder presentation means once the shoulder or trunk appears or enters to the pelvic inlet at the time of delivery. So there are three is there: cephalic, breech and shoulders. Okay. So in this, which one is the normal presentation means this is the cephalic. Cephalic presentation is the normal because the head should be enters to the first for the delivery. So the cephalic presentation is the normal one. And the breech, cephalic, shoulder, everything we have to learn in detail. But this is the terminologies I am just explaining what is that. Another terminology is my presentation. So already you have learned what is presentation, right? So what is presentation? That means which anatomical part is leading to the pelvic inlet during the time of delivery, right? So what would be the malpresentation? So the malpresentation will be the abnormal position of the baby during the time of delivery. So already we have discussed what are the presentation, right? Cephalic, breech presentation and shoulder presentation. So cephalic was the normal presentation. So once we come to the malpresentation, it would be breech or shoulder. Important terminology is position. So position means it is the relationship between the specific fetal denominator to maternal denominator. That means it is the position of the baby inside the uterus related to mother. Okay. So there are three positions are there: occipito-anterior, occipito-posterior, occipito-transverse. What are they? Occipito-anterior, occipito-posterior and occipito-transverse. So what is this occipito-anterior? In the occipito-anterior, what is the position of the baby? The head will be downwards but facing towards the back of the mother. That position is known as occipito-anterior. And second one is occipito-posterior. So occipito-posterior, the head will be down but facing towards the stomach region of the mother. That is known as occipito-posterior. And third one is occipito-transverse. The occipito-transverse means the baby's position is horizontally rather than vertically. Horizontally across the uterus rather than vertically. That is known as occipito-transverse. In this, the normal position of the fetus should be occipito-anterior. Okay, the normal position is occipito-anterior. That means the head should be down and the facing should be backwards of the mother. So you have learned about the position, and the normal position of the fetus is occipito-anterior, right? So once you come to the mal position, what the term it is using for? Once the position is abnormal, you can use the term that is mal position. Okay. So already you have learned three types of position. In that occipito-anterior was the normal position, and another two types was occipito-posterior and occipito-transverse. These are the mal positions or abnormal position. What are they? Occipito-posterior and occipito-transverse. If you have any doubts, please write in the comment box, and I will continue the same terminology in my next videos. Thank you.